show you a patient that has a stage 2 posterior tibial tendon dysfunction. And what we're going to do with this patient, we have used a subtalar joint stenting procedure. We used a HyProCure on this patient. And in addition to this, we also used a amniotic stem cell injection into the defect in the posterior tibial tendon. Now, the use of the subtalar joint stenting has been pretty effective in the literature. In 2016, foot and ankle surgery, November 5th, 2016, there is a study that followed 35 patients with posterior tibial tendon dysfunction stage 2, and they had a 74% success rate with these 35 patients. Some of the non-successful surgeries were required removal of the implant. With the type 2, it would be even a better study. The type 2 would probably show a little better results. But one of the things I think may happen is that in a stage 2 deformity, sometimes there's actually tear in the tendon, and that can be addressed a little quicker with a stem cell. So what I've been doing lately, the posterior tibial tendon dysfunction stage 2, I perform the HyProCure if it's amenable to the patient, and also implement amniotic stem cells. So this is what I'm doing here. I'm actually locating my posterior tibial tendon. We can move the big toe, and it shows us in this area where our flexor digitorum longus is going to be. So the posterior tibial tendon is on the top here. If you look in this area right here, you can see the defect in the posterior tibial tendon. So once I have that located, I'll then take the spinal needle. You can also use an ultrasound needle, and we'll basically, under the direct visualization of the ultrasound, just put it right into our area of defect here, which is right here in the tendon. Once we're in the tendon here, we'll then start to filtrate that into the peritoneum, into the area where the tendon is pathological right here, and just feather that up into the tendon. Now, what I found with this procedure, when you combine stabilization of the foot, which is the cause of this stress on the tendon, along with amniotic stem cell injections, just get a lot quicker recovery. This patient was in just about miserable pain and was unable to work. She works as a kindergarten teacher, and really only 3 weeks later she's a lot better, and she's actually going to go back to work in the 4th week. So this is a little better than some of the other things that have been done for this deformity. Obviously, there's in some patients you can use calcaneal osteotomies, and you can lengthen the external column and fuse the foot, but this is a lot less invasive, utilizing the HyProCure and the amniotic stem cells. Have a happy patient, a lot easier to do. This whole procedure can be done in less than 30 minutes instead of some of the larger procedures, which take bigger recoveries for the patients and much more intensive on the surgeon.